My name is Adelina Comas Herrera. I work at PSSRU, and my work at the moment is on the financing on long-term care, and particularly looking at whether long-term care insurance can have a role in supplementing or not public systems and how it can be made to work. The main issue is that we all know that in the next 20 years, 30 years, long-term care expenditure will pretty much have to double in most countries, most developed countries. And it's a case of thinking how we're going to raise those additional funds. Ideally, we'd want to be spending less, and that would require that all these people who are going to get older in the future might have better health, and that would be excellent, because then we wouldn't be needing to spend on long-term care. But as we can't quite bank on it yet, we do have to think about how we can raise additional funding. Governments seem to have a big problem raising additional taxes, so we really need to be thinking if more of these funds need to be raised in the private sector, how we can do it in a way that's efficient and especially equitable and that covers everybody. And our recent project funded by the AXA Research Fund was looking precisely at that. It was looking at whether there were ways in which private insurance could contribute to that. Our conclusions were that long-term care insurance as a solution works well in countries where you have a universal system that covers part of the costs of care. It doesn't seem to work so well in countries like the US, where private insurance is expected to cover the entire costs of care because premiums become unaffordable and very few people can buy them. So it offers a really small solution to only a few people. So what we've concluded is that private insurance on its own is unlikely to offer a comprehensive solution to long-term care financing. It seems to work well as a complement to a public system that's universal, that's predictable, and people know how much they need to cover themselves for, like in Germany and France. And there must be some new ways of private-public partnership that maybe can build on the good qualities of the public system, which is the guarantee of coverage and equity, and maybe the private capacity of the private sector to raise more funds.